Greetings, ladies and gentlemen. On behalf of the American Academy of Orthotists and Prosthetists, we would like to welcome you to today's webinar, On the Record, being presented by the American Board for Certification. Our initial primary speaker will be Mr. Jim Lawson. Jim is ABC's Outreach Development Manager and devotes his time to working with practice owners and compliance officers in order to help them navigate the accreditation process as well as improve their business practices. Without further ado, I'm going to hand off this presentation to Mr. Lawson. Jim, you have the floor.
Thank you very much, Chris. I appreciate that. Oh, make sure I get everything set here. Can you guys see the screen?
Absolutely, sir. Go right ahead.
Perfect. Thank you. Chris, I appreciate that, and thank you for your kind introduction. I would first like to start off by acknowledging that this past Tuesday, Brian and Stephanie really did a fantastic job with the Academy's first of these two webinars, The Anatomy of a Note. Now, if you weren't able to join that webinar, they shared with us an extensive amount of information. Was extremely beneficial. They went through the history of where we came from in regards to documentation, why we are and where we are today. Now today what we're going to do is we're going to look at our topic from a little bit of a different angle. We plan on using our time today to explore the direct link between your practitioner notes and the ABC accreditation standards. And we're going to address and spend some time on just the 4 specific standards applicable to our topic today. Now, with the February 2018 passage of the legislation that now recognizes orthotists and prosthetists documentation as part of the patient's medical record for medical review purposes, good, strong, sufficient notes are more important than ever. Now, not only is the documentation critical, your notes need to be clear and complete and tell the story of your patient's care. So with respect to all of your busy schedules today, we're going to keep this presentation very concise and rather brief. We're going to get right to the point and then give you plenty of time for your questions afterwards. So, and what I'm going to do also is I'm going to have a few of our experts from ABC join us to help answer those questions. So let's go ahead and get started. I apologize for this picture, if you can see that. Now, the Medicare will recognize your practitioner's notes, the patient notes, as part of the medical record. So let's discuss some of the ways you can properly document your patient's needs, your treatment plan, and their goals and outcomes, so that not only do your patients receive the care that they need, but very importantly, you receive the reimbursement you deserve. Now, what we're going to do today specifically on the ABC patient care and management standards that relate to documentation, that's what we're focusing on. So all of the standards are located in the ABC Patient Care Facility Accreditation Guide that you can find right here. You can find it on our ABC website. The guide not only has all of the ABC standards and tips and hints related to the standards, it contains a plethora, and yes, I chose that word carefully, a plethora of information and resources to help you and your staff be compliant in your patient care facility. If you don't have the laser version, please don't worry about it. I'll teach you how to get it a little bit later on in the presentation. I'll give you our website at the end, and it'll be a very, very easy download. Orthotist and prosthetist notes and patient clinical records have always been critical, even though it's been somewhat frustrating because we all feel they haven't received the respect that they deserve. We all know that. They've always been important, but with the passing of this recent legislation, they're now even more significant and vital to the process. We need solid documentation that hits the mark and it's consistent throughout your patient records using evidence-based practices. It's extremely important, evidence-based practices. The physician notes are still required, but your notes are now part of the complete record. Now, as I said earlier, I want to take a look at the specific ABC standards that address your clinical notes. We're going to start with an overall look at patient care and management standards, and we're going to refer to them as PC. Patient care and management standards address the essential components that support the delivery of appropriate, safe, and effective patient care and ensure that patient needs are met. Now, these standards are designed to address the following: physician interaction, patient rights, patient and family or caretaker education, and patient follow-up care. These standards are created to also be a guide for you and your team in establishing procedures to help you provide quality care for your patients. Now, the following 4 areas are covered by patient care, as we mentioned before, PC standards, and address the components required by the ABC standards. So let's take a look at those now. First, physician interaction and communication. If interaction with the physician is necessary, these standards relate to the required documentation that supports the continuity of care between you and your practice and your referral sources. Now, these standards relate to the communication mechanisms that you establish between your facility's professional staff and the patient's referring physician itself. So for patient rights, these standards are in place to ensure that you are providing an environment that facilitates the delivery of effective care and creating an atmosphere of mutual trust between you and your patients and your professional staff, which is extremely essential. Which basically means, be right to the point here, you have documentation that the patient has been informed of their rights. So patient and family education, the success of patient care depends not only upon the competency of the practitioner and the quality of the device, but also upon its proper and effective use and care by the patient, by the family members, by the caregivers. See, you can provide your expertise services, you can provide a tremendous quality device, yet if the patient or caregiver does not understand how to properly use the device, they cannot fully reach their established goals. And the 4th area is patient follow-up care. The standards in this section relate to the ongoing patient care and reflect the standards that care generally accepted by all of our profession. They require that you provide follow-up care appropriate to the patient's condition and complexity of their care, and of course, in accordance with the current valid order. But I do want to keep in mind, not every patient needs the same level of follow-up. So let's go ahead and dive a little deeper into the standards specifically. Let's see exactly what the standards are. So we're looking at PC 3.4. Now, PC 3.4, this standard states that the patient care provider must perform and document in the patient's record an in-person diagnosis-specific clinical examination related to the patient's use and needs of the prescribed device. All right, that sounds great. So what are we looking for? Your initial evaluation should include the following: sensory function, range of motion, joint stability, skin condition, the integrity of the skin, the color of the skin, the temperature of the skin, any diversity there. How about the presence of edema or wounds? Vascularity, pain, manual muscle testing. What about the functional limitations? Cognitive ability, and of course, the patient's medical history. Now, let me say this. Not all of these are appropriate for every type of patient you see. We understand that. We know that. But if you're assessing a patient for a custom device, then this list represents the baseline for what your clinical documentation should include. Let's take a look now at PC 3.4.1. Now, this states the patient care provider must determine and document the appropriate orthosis, prosthesis, or podorthic device. This determination must be based on the patient's need and must ensure optimum therapeutic benefits and appropriate strength, durability, and function as required to the patient. So in other words, what does the patient need this, and why does the patient need the device that you are recommending? So your patient records must document your determination and of course your rationale for the appropriate orthoses or prostheses and the appropriate materials, the components, the design based on the patient's need. Now, for example, if you're recommending the patient be provided with a custom AFO, your note should detail why the patient needs the custom device rather than a prefabricated one. So what factors are present that require the patient to be provided with this custom device? Again, what are the specific therapeutic benefits? Now, the next 2 standards, PC4 and PC4.1, are where you determine what your patients are trying to achieve. Do they see themselves as high-performance athletes? Do they simply want to be able to perform the activities of daily living? Or do they see themselves something in between? So let's figure that out. So PC4 states The patient care provider must document in the patient's record the patient's goals and expected outcomes related to the use of the item or services provided. So, it's essential that the patient records include documentation that specific patient goals and expected outcomes have been established. What goals have been discussed? What goals have been agreed on and set? Is the patient aware of what the potential could be? Has this been discussed in complete detail? Now, keep in mind, there are goals that the patient may set and goals that you, the practitioner, may set. For example, a person with foot problems may have a goal of standing on their feet for longer periods of time without pain. That could be their goal. You as the practitioner, your goal may be a little more technical, such as correcting a malalignment of their joints. And again, is all of this sufficiently documented in the clinical notes section of the patient's records? So looking on to PC 4.1, it tells us that the patient care provider must document the patient's progress towards meeting their goals and expected outcomes and related to the use of the item or services provided. So now that the goals and outcomes are documented in the patient's record, we want to take a look at the next step. How is your patient progressing? When seeing the patient for follow-up, you need to document how they are meeting their goals by referring back to those goals that were set at the initial eval. So are they making progress more rapidly than anticipated? Are they encountering issues that are slowing down their progression? Now, sometimes goals and outcomes change, and that needs to be reflected in the notes. You're the expert. Of course, that happens all the time. We want to see the changes in the notes, though. In all situations, we need to continue to update the notes as they proceed their treatment. Once again, getting back to the basics, we're continuing to tell the patient's ongoing story. So we're looking at PR. Now we're talking about patient records, and we refer to this as PR. The patient records PR section of the standards contains specific requirements on centralization, accessibility, and protection of patient records, as well as keeping protected health information, PHI, secure and confidential. And I want to throw this this last button in here. Federal HIPAA regulations apply to all facilities providing care. Your practice needs to have well-established, documented policies and procedures that address the creation and maintenance of patient records. So an effective patient record program must adhere to those top 3 principles. Secure and confidential patient records. Now, your practice must maintain a secure patient record system that allows for prompt retrieval of all patient records. Again, it's critical that all patient records be treated in strictly confidential manner. So regarding the backup of patient records, if using electronic medical records, EMRs, for patient care, you must make sure that the data is secure and backed up on a regular basis. See, I've heard of practices where the computer system has gone down, they've not been backing up their records, and because of that, they're forced to close their practice for an extended amount of time. Even if you don't use EMRs, electronic medical records system, you must have a policy in place to protect your patient records from loss or damage. There have been many stories where there was no backup for the records and not protected and all was lost. Just personally, I've had different practitioners, business owners. Everyone remembers Sandy, Hurricane Sandy. Hit us 3 or 4 years ago up on Long Island, New York. We had a couple of practices that one practice had 4 feet of sand in the first floor right through the whole practice. And unfortunately, it took them an awful long time because they didn't have backup of many of their records. It's really imperative. No one wants a situation like that. So let's talk about consistent patient records, PR 6.1, and it states that your patient records must include patient evaluation and assessment. That is the cornerstone we're building our entire patient care on. Please take note of that. It needs to contain the diagnosis, the prescription or valid order, relevant patient history and medical necessity. That's extremely important. Pre-treatment photographic documentation as appropriate for the item itself, if there are pre-treatment photos. See, more and more practices are using these every single day. Confirmation that the patient education was provided. We want to see that documentation. The name of the practitioner and complete documentation. We're looking at the name of the practitioner, their findings, the recommendations, the treatment plan, the follow-up schedules. The complete documentation of your entire patient records needs to be consistent throughout all of your records. So getting back to one little point with the photo documentation, if you're using photo documentation, do you have a policy that describes when and under what circumstances these type of documentation is used? Are you conducting your assessment? Or are you recording the informative data that you're using to support your treatment plan? Are the patient's goals and objectives, are they measurable? We want to keep that in mind. So here's an example. So if your patient was able to walk 50 feet in 2 minutes before the treatment, and now they're able to walk 100 feet in 2 minutes after the treatment, how does the data support the success of treatment plan? That's just one example of the data, okay? Let's take a look also for PR 6.1 in patient records. Your patient records must document the patient need for use of orthoses and prostheses, including pertinent medical history here. Have you interviewed the patient to get as an in-depth as history as possible? Again, that's telling the story we need. We need that baseline. That's something for us to build on. How about allergies to, allergies to materials? This would include all the materials could potentially be used. I've got a little personal story with this. My wife and I adopted a foster child last year. She's an 8-year-old girl, wonderful child, and we love her dearly. And she was recommended, she had a prescription for orthoses. And she went in to get her braces made by the practitioner. And we went in and we had the fitting and came back home and everything was going well. And within about a day or so, she started getting very difficult rashes on both of her legs, the back of both of her legs. We went back in, we took them off. The rash went away in about 3 or 4 days. We told the practitioner, he went and looked it all through. He said, everything looks good. We tried it again. Within 24 hours, the rash was back. So we went back in and he took out the lining and redid it and did the work and came back. And the third time, the rash came back and we were checking all of the materials, except we did not check the adhesive that was being used for the lining. And we found that the adhesive was really the main issue. She was having a reaction to that. So with just that story's hopefully sharing this, we want to check to make sure that all of the materials are checked, okay? We're going to check the skin conditions, diagnosis, documentation of all of this. Previous use of orthoses or prostheses. Is there a history of device usage? Okay. Were there successful users of the device? Were there any issues? We don't want to get cold cocked. We don't want to get blindsided. There are times when practitioners are not aware of the patient's previous usage of orthoses, so we want to make sure that we do ask those questions. How about the result of any diagnostic evaluations or tests? And patients' expectations. Again, are they aware of their potential? Have all the possibilities been discussed with the patient? Remember, this could be their first experience with O&P, and you are the expert. So the standards that we've discussed today specifically, again, relate to the legislation passed in February. I understand it sounds like a broken record, but ultimately, again, you need to tell the patient's story and support your work with in-depth and comprehensive documentation. What we need to do is we need to show how we came up to the conclusion of what objective measurements were used. If you're able to aim for the best written, the most thorough clinical notes, then you not only create the appropriate patient record, but again, you have all of the information you need if you're subjected to an audit or to denial of your reimbursement claim. So, as always, the number one goal is it'll help you provide the best possible patient care. I want to pop this up real quick here. I'd like to share my contact information because we're going to have time for Q&A here, but at any point, don't hesitate to reach out to us. I'd also like to share with you the contact information of the ABC accreditation team that's right here. Please don't hesitate to contact them up there. I wanted to give also a shout out to all of our ABC surveyors. They're all over the country and sharing our best practices with the ABC accredited facilities. It's often I hear from the business owners and the practitioners that our surveyors have helped them through documentation issues, and I'd just like to publicly thank them for their good work and dedication. Please, if you have questions of them, don't hesitate to ask. Please don't. I said earlier we'd show you where you could locate all of ABC's resources. This is our website, abcop.org. This is a photograph of our staff. I'm lying to you. This is not our staff. If that is our staff, I would have been rejected from the photograph. They're much better looking than I am. So go to our website, abcop.org, and just download your own copy of the guidebook that I was showing you earlier with the tips for the compliance. And each standard has an accompanied tip that'll help you with your compliance. I'd also like to encourage you to reach out to any of us with your questions. Don't hesitate to that. Just come to ABCOP, and all of those resources and tools are there. I think this is a good time, Chris, that we could go ahead and take questions on anything that we've covered today. I have three people that I'd like to introduce from ABC who's going to join us. First, let me introduce Tammy Richards, who is ABC's Director of Facility Accreditation Services, and Kyle Sins, who is ABC Standards Compliance Specialist. And then we're very fortunate also to have Steve Fletcher with us. Steve Fletcher is a CPO and an LPO, and he is the Director of Clinical Resources here at ABC. And I think, Chris, this would be a good time to take the first question, if we have any of those.
Jim, right
Yes,
now
sir.
it appears a couple of individuals are feverishly typing away. If you
Okay,
are attending this webinar live, do submit your questions utilizing the GoToWebinar questions window.
Steve or Tammy or Kyle, in the meantime, do you have anything that you'd like to share follow-up of what we have just been through?
I'm not sure if my speaker is turned on or my microphone. Can you hear me, Jim?
Yes, we can.
Okay,
yes.
Great. I would just highlight one part that you covered while we're collecting the questions. I think our surveyors, as they have, over the years, when they do the site survey and they do the chart reviews, one of the areas that is the most commonly sort of missing element is the establishment of goals. It is really definitely challenging for a very busy practitioner who is seeing multiple patients a day when they go back to do their notes to really document clearly what were the goals that were established. We all have goals. Every practitioner who sees a patient, there's a goal to why the intervention that they're recommending, why they're doing that. But sometimes it's hard to document that. It's not always straightforward and easy. So I just would highlight that that's what our surveyors see is sometimes missing. The note may be pretty comprehensive. It may have all the elements, but the goals aren't really clearly documented. You could interview the practitioner or even the patient and probably get a pretty good goal of why did you get this device, but it's not documented clearly. So I just would highlight that's what we see is sort of one of the weaker areas of a typical practitioner's notes is the clearly defined goal that was established, and then even more so down the line at follow-up, were that goal or were the goals met, and what's the status of that?
Steve, thank you for emphasizing that. Steve, I have a question with that. As I was talking about, from the patient side, they would have their own goals that and hopefully through discussion you're going to get those goals out of the patient, and with the practitioner's expertise, you're going to create the goals together. But as I was mentioning, the patient, the example I gave is the foot hurts. They want to be able to stand for a longer time without the pain. Would you include in the patient's notes the patient's wording as well as the practitioner's wording for that, for when you're establishing your goals?
Absolutely. There's sort of two types of goals. I mean, there's more than two, but the two big categories are sort of patient-driven goal and a practitioner-driven goal. Obviously, the practitioner is the technical expert of what the pathology or the functional limitation is. So it's really, sort of, at least in my experience, the first thing that comes to mind is sort of the biomechanical issues that we're going to address with the device. And orthotically, it's a little easier to think about than prosthetically, perhaps. But we see someone with a very collapsed foot, and that they have really hyperpronation, their forefoot is abducted. The goals from the practitioner's perspective may be sort of technical, if you will. We're going to try to maintain a corrected alignment of this structure. But the goals from the patient's perspective is probably a lot more general to, I want to be able to ambulate without my feet hurting. I want to be able to stand on my feet for longer periods of time. I want to feel more balanced when I do certain activities. All those are really good. So I think there are those two types.
And that is the language you're going to be going back when you're reviewing the goals, when the patient's follow-up care, that you're going to be using with the patient themselves as opposed to the technical terminology. Am I correct?
Correct.
Okay, very good. Thank you, Steve. Chris, do we have any questions?
We certainly do. One of the first questions is, does ABC have any templates to assist with documentation?
Well, what an excellent question. Yes, we have a listing of, we have a resource pack that was started about 2 years ago, and it is updated constantly. And in that resource pack, it is on our website. If you're accredited with ABC or if you applied for accreditation with ABC, it is at your fingertips on our website. You just log in to My ABC and you put your practices password and practices username in there for your accreditation username, and all of those at your fingertips. There are a total of, I think right now, 19 charts and templates and information pages that will help you be compliant and with your facility accreditation. So yes, by all means, those are available, and they're available to you right now.
Very good. And actually a related question. In addition to the template that you described, does ABC have any information regarding specific measurable goals or outcomes that would be recommended in patient care?
Steve or Tammy, would you like to address that?
Well, I'll jump in, Tammy. No, the short answer is no. ABC doesn't have a recommended sort of list of, here are the measurable tests that you should use. Really, we look to the Academy, to be honest, as sort of the professional society and the leaders of sort of state of the science, work that they've done, and so I think there's a variety of places you would find that information, and sort of outcome measures, research, and the information that has come out of the Academy's research councils. So I don't know, Chris, if you want to maybe even tackle that. I mean, from ABC's perspective, we don't have a list of those tests.
If I were to put on my Academy hat, I would say that, first of all, our speaker from Tuesday, Mr. Brian Califf, actually chairs the Outcomes Subcommittee. And there are a series of resources available on the AAOP website, including videos that even demonstrate how to administer some of these validated outcome measures. Secondarily, a resource called rehabmeasures.org is available, and it is created by an organization known as the Shirley Ryan Ability Lab, which used to be known as the Rehab Institute Chicago. So rehabmeasures.org is another excellent resource to find that information.
Thank you, Chris. There's good information out there. You just make sure we get to the right place to find it.
Excellent. I have an interesting question regarding documentation. Are there ever instances for documentation where the practitioner overdoes documentation or provides more information than necessary to comply with Medicare's guidelines?
Well, Steve can jump in here. My first thought on that is, and we've been hearing this ever since the RAC audit started, you cannot document enough. And that's been kind of the general thought process out there that everyone's been sharing. But Steve, do you have any specifics on that?
Yeah, obviously it's hard to think about too much documentation. I think it's more the content of your documentation than the amount that I would think about to respond to that question. Obviously we're educated to be pretty objective in our documentation, expressing an opinion about, the patient's social situation or family situation. That's the only thing that comes to mind when perhaps the narrative in our note crosses a line where it is making comments on, sort of, if you will, subjective comments on the patient's living situation, just sort of commentary that is beyond the scope of what the interaction is really, the person's been referred to us for. But I think that I think I understand the question might be coming from, is there just too much detail in the documentation that an auditor perhaps might pick apart to say, well, we didn't see enough of a benefit to the intervention that was provided to warrant reimbursement. We haven't reached that point, in my opinion, yet, to where payers are really drilling down to the level of, well, they only gained X amount of benefit from the device, and that's not enough for us to reimburse it for. I don't think we're there yet. That may be where this question's coming from.
Very good. On a slightly different tangent, we have a great question regarding use of photographs. When a practitioner uses a company's cell phone to take images of a patient in the clinic, must those photos be deleted at some point? And are there any liabilities associated with having those images if the phone is lost or stolen, resulting in photos being released outside of the clinic?
Just from my experience and my past history of listening to many attorneys, there could be liabilities without a doubt on that. Steve, I don't know the exact, I don't have knowledge on when they should be deleted, how they should be stored, but I know it's need to be securely stored. Do you have thoughts on that?
I do. If the question's asking, it's a company issued cell phone, so it's a company property. That's not that different than the company computer or a tablet that's used in the clinic to take a photo or a video. So all of that data needs to be protected and secured. And so the interesting twist on this is that a cell phone is obviously very mobile and could be lost or left somewhere, and then now you've potentially exposed that. I think it gets down to how encrypted is some of the data, how secure is your phone from being accessed, is there password protected, et cetera. So I think what we would look for is, has the practice or the individual taken the necessary steps to protect the protected healthcare information, the confidential information of that person's healthcare record. So the cell phone is just a twist because it's so mobile. I don't believe that ABC accreditation standards really address specifically, does it have to be deleted after a certain period of time? I think the expectation is that all of that data is being protected appropriately. And so each practice should come up with their own policy and really follow it to say, on a weekly, on a monthly, depending on the volume, on some time frame, that those images are deleted off of the phone and that they've been uploaded to a secure system. I think we would look for that kind of policy that's being followed and consistently from the practice.
And you're right with that, Steve. The must have a policy for the security and the encryption. That is important.
Very good. Moving forward, wonderful question. Is there a specific time frame when a practitioner's notes must be completed with regard to a patient's office visit?
Wow, these are tough questions, Chris. I would say a couple of quick comments to that. There is not a prescribed time frame that ABC's accreditation standards would say you have to have the note completed by X. We would really, again, go to the facility itself to say, what is your policy? And then what's the rationale behind that policy? In other words, are you doing everything to protect the patient's interests in this? One somewhat indirect, but I think is a little bit related, in the issue of privileging or supervising caregivers. We do have a requirement that those notes are countersigned within 15 days of the care being provided. So I think practices can use that as a guideline. It isn't meant to be a specific requirement that you have to have the note done within 15 days if you're a credential holder and you did the care. But I think it's at least some direction and guidance that says, if you have an assistant or another credential holder that you've privileged to provide some care, that note has to be countersigned and completed, obviously, within 15 days of the care being provided. So I think that's as close to a direct answer that I can provide.
Steve, you're correct with that. With the privileging is the only standard we have that has a specific time period on it. But today is Thursday, and I ask people this all the time. I get this question a good bit. What did you have for lunch last Friday? We forget things. Getting the information into the patient's record as quickly as we can, and as precisely as we can, before things start to slip away, I think that would be the best practice.
Very good. With regard to certification documents or actual state licenses, are they required to be posted either physically or in digital format so that the patient can see them within the clinic?
Generally, they are posted along with their accreditation certificate. Very often, it's out. They're posted where they can all be seen in whether the waiting room or the registration area. Tammy or Steve, anything to add to that?
Hey, Jim,
Kyle?
this is Kyle, and I'll
Great.
hop in here real fast. Yeah, there is a requirement for that. It's AD.1.2.1, and it's that you have to display all licenses, certificates, and operation permits in a location accessible to the public. So that those documents should be available for patients to see in somewhere public.
So, for example, if you have 3 exam rooms and you put them on the wall between exam room number 2 and number 3, that is not accessible to the public.
More like that in the lobby for certificates, or I mean, you can have copies of them in separate places, but they should be posted somewhere that the patients can see these kind of certificates and licenses.
Very good. Thank you.
Excellent. And we have multiple questions regarding the templates discussed initially. Where would the practitioners navigate on the ABC website in order to find those templates?
You would go to, and I can't pull it up right now because I still have the presentation in front of me. I apologize. You would go to our abcop.org. Is someone going to say, Tammy, you're going to say something?
Yeah, so I was
Please go right
just
ahead.
going to jump in. So it's really not available to individual practitioners. It's available to the facility account only. So if you have a facility, your facility has its own account that you can log into and download these forms. So if you are unsure about what your facility login and ID is, just shoot us an email and we can give you access to that. But only facility accounts can access the forms.
And as I mentioned earlier, they're available to all ABC accredited facilities and those who also have applied for accreditation with ABC.
That's correct.
Excellent. And given the timing of our session, Jim, we have a few moments. Do you have any closing comments you would like to make?
Just thank you, everyone, and it's a great partnership with the Academy and ABC. And we were talking earlier that we'd like to do this more often. I think it'd be a wonderful thing to do. Our profession is relatively small. We have different authority organizations, and seeing all those organizations work, the more we work together, the better it's going to be for representing our profession and also taking care of our patients and offering the best healthcare possible. So I'm strongly encouraging that we continue to do things like this, the webinar series we had Tuesday and today. Please, once again, if you have any questions, do not hesitate to contact us. Tell you what, let me pop this back up here. Here's my email, but probably even more importantly, there's the accreditation department's email, and you can dial our main number 703-836-7114. And we have different people in our accreditation team who are experts, and they focus on different areas of accreditation, and they would be very, very happy to walk anything with you. If you feel you don't understand it after a good conversation or an email, call us back. We will explain it as many times as we need to. We are here to help you. And I'd like to thank Steve and Kyle and Tammy for helping us also, and Chris and Shelley and everyone else who's been a big part of this. Thank you all very much.
Thank you.
Excellent.